Hi, I'm Dr. Eric Kuelker. You're probably here because you feel pain and overwhelmed, and you want things to improve. You can become free of the tension and misery that you feel right now. But picking the right psychologist to work with can be difficult. Many mental health professionals are somewhat helpful, while a few are super shrinks. These psychotherapists are up to 10 times more effective than the average therapist. I've worked with hundreds of clients over the years and use a process that results in highly effective psychotherapy. Let me explain it so that you know what is the best help available for you.
A good analogy for the process is if you're planning to renovate your kitchen. You want to hire the best person possible to carry out this major change in your home. One contractor comes in, looks around, opens cupboard doors, and gives you an estimate. The next guy comes in and he measures everything. He measures the height of your counter, the depth of your sink, he measures everything in the kitchen, and he writes it all down. You're puzzled by this. You phone up the first contractor and ask why he didn't use a tape measure. He says, "Look, I've been doing this long enough, I can just eyeball it." You phone up the second one, and he says, "I measure everything in order to get it exactly right." So, which carpenter would you hire? The principle is clear. When people measure what they do, their work is superior to those who just eyeball it. The objective feedback keeps them on track. The same principle applies to psychotherapy. When mental health professionals get objective feedback by measuring, it sharply improves therapy. This process is called feedback improved therapy. I use this principle. At the beginning of each session, clients fill out a quick measure of how they're feeling. At the end of each session, clients complete a measure of their sense of teamwork with me. That way, we can tell if therapy is helping you, and if you feel we're working well as a team. There have been several studies looking at how much therapists improve when they get objective feedback from their clients. The first study, by Dr. Reese at the University of Kentucky, found that when therapists verbally inquired of their clients how they were doing, then clients improved about 5 points on a 40-point scale of psychological distress. However, when the same therapist objectively measured how their clients were doing, then those clients improved 10 points on a 40-point scale of psychological distress. Dr. Reese repeated this study. Again, he found that when therapists verbally inquired, that clients improved by about 6 points on a 40-point scale. However, when the therapist used objective feedback, then those clients improved 12 points on a 40-point scale. This study indicates that objective feedback doubles the effectiveness of psychotherapy. Another interesting result that Dr. Reese found was that effective therapy is efficient therapy. Not only were clients who were giving objective feedback to their therapist getting much better, they were getting better faster. They needed 30% fewer sessions for them to reach recovery, compared to clients treated the usual way with verbal inquiry. Two other studies have looked at how feedback-improved therapy dramatically helps in marriage therapy. This information is in the tab Effective Therapy.
In every single session, I measure the progress of my clients and their sense of teamwork with me. If you choose to work with me, we will know if therapy is helping you to overcome your problems and if it needs to be fine-tuned. With feedback improved therapy, you get the best help available so that you are feeling better soon.